A treatment strong enough to cure patients with an acute form of leukemia has been limited in use due to concerns about its serious, potentially fatal side effects. New research is suggesting that for the majority of the patients, the benefits outweigh the risks. Haley Weldon filed this report for the Journal of the American Medical Association.
Randall Burnham went into the ER feeling fluish and came out with a diagnosis of acute myeloid leukemia.
It was just a week before I was diagnosed that I started to be having these fevers and chills.
12,000 new patients every year is, a sizable number of people who have to deal with a potentially life-threatening illness, where a couple weeks earlier they would have been fine going about their everyday business.
A chromosomal analysis early on serves as a powerful predictor of a patient's response to treatment. It classifies the patient's leukemia as poor, intermediate, or good risk. Initial treatment of AML consists of chemotherapy, and nearly 70% of patients under age 60 enter into remission after receiving it.
In other words, the bone marrow and the blood have been restored to a normal-looking state. They aren't cured, there's still cancer lurking.
But the optimal next step to prevent a relapse is unclear, which led Dr. John Careth of the Dana-Farber Cancer Institute and a team of colleagues to collect and analyze data from 24 studies on allogeneic stem cell transplantation. In this procedure, healthy blood-forming cells taken from a compatible donor replace the abnormal cells in a patient's bone marrow. These transplants have a higher risk of serious side effects, but result in a lower rate of relapses. The research is featured this week in JAMA, Journal of the American Medical Association, and finds that allogeneic stem cell transplantation can clearly boost the survival rate of patients with poor and intermediate risk AML.
For intermediate risk, even the experts were stumped. We're coming along and saying, actually, it's fairly straightforward. You should strongly consider an allogeneic transplant rather than the alternative treatments based on the cumulative experience of several thousands of patients.
Relapse-free 2 years after his transplant, Randall Burnham is appreciating the little things in life more than ever.
Hugging your grandchildren is a big boost to your feeling well-being. How you are going to get through the changes that have taken place in your life.
Haley Weldon, The JAMA Report.